There's a serious spike in the number of measles cases in Canada. 5 provinces have been hit. An outbreak in British Columbia's Fraser Valley is now up to 320 cases. There's 1 case in central Alberta, 11 in Regina, 2 in Winnipeg, 3 in Hamilton, and 4 in Ottawa. So hundreds of confirmed cases. It sounds pretty unnerving, enough to bring in Dr. Peter Lynn, CBC News medical contributor. So how worried should we be?
Yeah, the concern is that it's not contained. And the problem with measles, it has about a 90% attack rate. So if I'm standing next to you and you don't have immunity, it will go to you 90% of the time. And the other concern that we have is not so much the rash or the actual infection, it's the complications, the pneumonia that comes afterwards. And for every 1,000 people infected, there might be 1 or 2 people that die from the measles, and 1 or 2 might get encephalitis and inflammation of the brain. So it's those things that we're concerned about. And the other thing is that the rash shows up about 4 days later. So you're infectious to other people for about 4 days before we even know you have the measles.
Now, one thing that also kind of stands out is we normally think of measles as a kid's disease, but in this case, it seems a lot of adults are getting it.
Yeah, exactly. So it turns out before 1970, most of us got measles naturally. In other words, you got the infection. So in Canada, there was about 300 to 400,000 cases a year before that time. The vaccine comes in the middle of the 60s. So now all of a sudden, around 1970, everybody should have been vaccinated. So after that, there's no natural measles. So therefore, if you're born after 1970, you really need the shot to protect you. And so those people are the ones that we're afraid of the most. Now, if you're in the group before 1970, but you're in high risk, healthcare, military, or you're traveling to an area that has a lot of measles, you still need vaccination. We just can't assume that you have immunity. So for that group of people, if you are going to be traveling, please make sure you're vaccinated.
All right, Dr. Lynn, thanks very much.
Thanks.